Good morning, everyone. I am Robin McLaughlin. I'm the Director of Philanthropy at Insight Memory Care Center. I'm also the lead for Dementia Friendly Fairfax. So I get the opportunity of welcoming you to the Dementia 101 webinar today. Thank you so much for joining us in our three-part series. This is the second of our third. Next week, we have 5 ways to take care of your brain. So hopefully you'll join us for that as well. But I just want to give you a quick overview of what Dementia Friendly Fairfax is and who we are so that in case you want to get involved. Dementia Friendly Fairfax, it's an initiative that was started in July of 2019 through a partnership with Fairfax County, Goodwin House, and Insight Memory Care Center. And we have a vision for our community to be a place where people living with dementia and their care partners will be able to engage in activities, be supported in the highest quality of life, and can live independently as long as possible. So if you're looking for like an opportunity to get involved, need a volunteer opportunity, we would love to have you join the action team for Dementia Friendly Fairfax. Please reach out to myself or Lindsay. You can go to insightmcc.org to find out more information. Now let me introduce your trainer for today. You get Lindsay Vajpayee. She's the Director of Education and Outreach at Insight Memory Care Center. Welcome, Lindsay.
Thank you, Robin.
You're welcome. Lindsay has dedicated her career to working with older adults who live with dementia and their caregivers. Her certifications include Certified Dementia Practitioner, Certified Alzheimer's Disease and Dementia Care Trainer, Activity Director Certification with specialization in memory care. She's a master trainer with the Best Friends approach to dementia care, and she's also a Dementia Friends champion. So you are in good hands for the training today with Dementia 101. And so I will turn it over to Lindsay and enjoy the training today. Thank you.
Thank you so much, Robin. And good morning, everyone. I'm so glad that you're with us. Before we move into the actual class, I wanted to point out, for those of you who are listening live, 2 functions in your control panel. So I want to point out the handouts section. If you click on handouts in that control panel that's to the right on your screen, you'll be able to access the slides for today in the PDF format. And also, if you have questions or comments throughout today's class, please feel free to enter those in the questions box of the panel, and we will address those at the end of the class. So go ahead and put those in as I'm going through the material. So Dementia 101, let's actually start with what is normal with age. We do change as we age, right? Our bodies are changing, our brains are changing too. With age, it's normal to walk into a room and forget what you went in there for. You know, I walk into the kitchen and I think, what did I come in here for? But a few seconds or a minute later, I realize what I intended to do and I complete that task. With age, we may lose things from time to time, but we can still backtrack and probably find that missing item. We might forget about an appointment, but remember it later. Oh, I'm so sorry, I forgot. I might make a bad decision once in a while. I might have other mild forgetfulness that doesn't significantly affect day-to-day life, right? There are irritating things that might happen, maybe occasionally embarrassing, but they're not getting in the way of everyday life in any substantial way. And then we have a list of warning signs. These are things that are not normal with the aging process. So this list of warning signs is from the Alzheimer's Association. The first warning sign of a memory problem that's not normal aging, memory loss that disrupts daily life. You know, really forgetting important information, frequently forgetting information that has been recently learned. This might take the form of your friend asking you the same question multiple times, or sharing that same story, you know, multiple times within the same conversation. Another warning sign is challenges with planning or solving problems. You know, deciding what I need to do and in what order I need to do those things to accomplish my goal, and how do I manage a problem if it arises. You know, if the stove starts on fire, or if my car has a flat tire, or if my phone won't work, how do I troubleshoot that in a reasonable way? The third warning sign is difficulty completing familiar tasks. So things like using your cell phone, driving to familiar places, paying your bills each month, you know, making a phone call, these kind of day-to-day things that we do, if they start to become particularly challenging, you know, taking much longer period of time than would be considered normal for me, you know, that's something that I might be concerned about. The fourth warning sign is confusion with time or place. Really not just, is today the 14th, the 15th, the 16th, we all make those kinds of mistakes, but really losing track of, the date, the season, the year, the passage of time, or becoming really disoriented when in a new location. The fifth warning sign is trouble with visual images and spatial relationships. So this is not exactly a problem with the eyes changing as we age. I mean, that may happen too, but this is really a reflection of how the brain is changing, and that the brain isn't able to process and make sense out of all the information that our eyes are bringing in. So what you might see in everyday life would be difficulty, determining like color contrast. If two things are almost the same color, I might not notice that the difference, or having some difficulty with depth perception. The sixth warning sign is new problems with words in speaking or writing. I might have difficulty finding the word I want to say once in a while, but this is when it really starts to become, kind of a regular occurrence. Difficulty with word finding, tracking conversation, adding to a conversation, understand what I'm reading and making sense of that. The next warning sign is misplacing things and losing the ability to retrace steps. Just losing things isn't always the problem. I mean, maybe I've always been someone who can't keep track of my keys or my glasses, but the issue here is when I can't walk backwards in my mind and probably find that missing item. Where was I? Where was I last time I had that item? Checking all those usual places and probably finding it. With this warning sign, that person really is losing that ability to kind of walk backwards in their mind and find this item. This person may put things in very unusual places. The next warning sign is decreased or poor judgment. We might all make a bad decision once in a while, but this is when it really starts to become a pattern. Really falling victim to scam after scam, giving large sums of money to someone I wouldn't normally give money to or couldn't afford to give money to, or using really poor judgment with something like driving, or even getting dressed in the morning. What should I wear today based on the activities that I'll be engaging in, the weather outside. The ninth warning sign is withdrawal from work or social activities. Pulling back from what that person used to do, maybe retiring earlier than expected from work, no longer taking on those volunteer commitments that that person had previously been very passionate about, turning down opportunities for social connections, having dinner with a friend or attending a family gathering. And the 10th warning sign is changes in mood or personality. Becoming more confused, much more irritable, anxious, fearful, and just changes that are not attributed to something else. As a person ages, there are other things they may experience as well. Maybe I'm experiencing depression. Maybe I'm having sensory changes, right? Maybe I'm grieving the loss of a loved one. There are so many reasons why I might experience any one of these warning signs for, a certain period of time. But if you're noticing your friend, your loved one, your neighbor who's exhibiting some of these warning signs, and it's becoming pronounced, it's really noticeable, it's happening on a regular basis, it's starting to be concerning, that's what I'm talking about here with the warning signs. So I want to address a term called mild cognitive impairment, or MCI. Mild cognitive impairment is a term that we use, where there's a memory problem or another cognitive change that it's not really normal for age, but it's not significantly interfering with daily life. Maybe there's a noticeable memory change, but it's not impairing that person's ability to live independently and to take care of the majority of their own needs. With mild cognitive impairment, there are basically two or several different subtypes, but the main categories are amnestic and non-amnestic. Is there a memory change, or is it a different cognitive change that doesn't have anything to do with memory? When someone has mild cognitive impairment, this is technically not a type of dementia. When we talk about dementia, we mean that now these changes are interfering with daily life. And with MCI, these changes we're noticing them, but they're not interfering in our daily life in any significant way. When someone does have MCI, it does increase risk for developing Alzheimer's or another form of dementia in the future. So what is dementia? Dementia is what we would call an umbrella term. It's just a general word that describes a group of symptoms that affect our thinking abilities, like executive functioning, judgment. It may affect our language, our ability to find words to communicate effectively. It may affect some of our social abilities, interacting with other people in social situations. It may interfere with memory. And when someone has dementia, we mean that now these changes are severe enough that they are interfering with daily life. They're not only just a little bit noticeable, they're really starting to get in the way of that person's ability to make wise decisions, take care of themselves, live independently and safely. Dementia is not a normal part of aging. Risk for many types of dementias increase as a person ages. They're more common for older adults, which is why we tend to associate dementia with aging. But dementia is not a normal part of the aging process. And dementia is not one specific disease. Again, it's just kind of a general word that we use to describe a set of symptoms. It's not one specific disease. There are many types of dementias. There are many diseases and conditions that we would call dementia. So the most common type of dementia you may be familiar with is called Alzheimer's disease. But there are many other types as well, actually more than 100 types of dementia. Some of the less common types include dementia with Lewy bodies, frontotemporal degeneration, vascular dementia, and others. So we're going to talk about some of these most common forms of dementia today. So let's start with Alzheimer's disease. Alzheimer's accounts for about 60 to 80% of dementia cases. So not all of them, but well over half of people living with dementia have this specific disease happening in their brain. Alzheimer's is irreversible and it is progressive. We know there will be change over a long period of time. That change tends to be gradual, but it's not going to stay right where it is. There will eventually be additional change. Generally with Alzheimer's disease, one of those first warning signs that we see involves short-term memory loss. That person who forgets recently learned information. What did I have for breakfast this morning? Did I take my medicine? What did the doctor tell me at my appointment last week? Those kinds of things that have happened in the last hours, days, weeks, months, maybe even the last few years. These are some of the things that we notice changing. The person in that early stage of Alzheimer's could probably talk at length about things that happened years and decades upon decades ago. With Alzheimer's disease, it doesn't only affect memory. It also can affect other thinking abilities, like judgment and executive functioning. It can affect behavior. It can affect that person's ability to care for themselves. Over 5 million Americans have Alzheimer's disease, and most of those are over the age of 65. Basically, the older someone gets, the more at risk they become for Alzheimer's. However, there are about 200,000 individuals in this country who have younger onset Alzheimer's, or sometimes called early onset. So this means they were diagnosed before the age of 65. The hallmark of Alzheimer's disease are these amyloid plaques and tau tangles in the brain. And I'm going to show you a video in just a moment that's going to talk a lot more about what's happening in the brain and really help us to visualize and understand this. There is no way to stop or slow Alzheimer's disease at this time. However, there are treatments for symptoms that are available. So let's show a quick video. Actually, it's about 4 minutes long, and it's from NIH, and it's going to really walk us through what's going on in the brain with Alzheimer's disease, and it will also touch on what's happening in the world of research. Okay, welcome back. So I hope that helped to explain a little bit more about what's happening with Alzheimer's disease. And even though Alzheimer's disease kind of gets all the spotlight when it comes to dementia, there are other forms of dementia that we really want to be aware of as well. The second most common type of dementia is called vascular dementia. And this occurs when there's a brain injury, such as a microscopic bleed in the brain or blood vessel blockages. So think stroke or mini stroke. With vascular dementia, the symptoms really vary from person to person and over time, depending on the location of this blockage in the brain, the number that there have been, the size of these infarcts, these brain injuries, and how that affects the person, really does change. Where were these strokes occurring? How many have there been? And that's going to tell us, that's going to show us a little bit more with those outward symptoms. With vascular dementia, it frequently progresses in more of a stepwise pattern. So with Alzheimer's, we tend to see kind of a gradual decline over a period of time. With vascular dementia, it goes a little bit more like stair steps. I'm right here, and then I have a vascular incident, like a stroke or a mini stroke. And now I'm here, and then I kind of stay right there until there's another vascular incident. And then there's a change. So vascular dementia's progression looks a bit different than Alzheimer's disease. And then the next most common type of dementia is called Lewy body dementia, or LBD for short. Lewy bodies are abnormal clumps of the protein alpha-synuclein that accumulate in the neurons in the brain. And when we say Lewy body dementia, it really can mean two different diseases. It can mean Parkinson's disease dementia. So most of you may be familiar with Parkinson's disease. It's a neurological condition, a movement disorder. There are some physical changes that occur. And for those living with Parkinson's, about 50 to 80% of those individuals will eventually develop these cognitive changes at some point in that Parkinson's process. And so we call that Parkinson's disease dementia. And then if we think about this like a spectrum, kind of at the other side of the spectrum, we have dementia with Lewy bodies. With dementia with Lewy bodies, we notice these cognitive changes occurring first, and the movement features either coming along around the same time or later. So it's really these cognitive symptoms that are the primary concern. So Parkinson's disease dementia and dementia with Lewy bodies share a lot of really similar characteristics and are considered sort of 2 points on the spectrum. So together we call them Lewy body dementia. With Lewy body dementia, some of the common symptoms can include impaired thinking abilities, fluctuation in attention and alertness, problems with movement. So think some of those, Parkinsonian features, maybe balance issues, shuffling feet with walking, swallowing changes, those sorts of things. Hallucinations can be common with Lewy body dementia. Not everyone experiences hallucinations, but they are certainly not uncommon. And when we talk about a hallucination, it's when that person really thinks they see or hear or feel something that's not really there. Now, this is different from a delusion, which is a false belief about something. So hallucinations can be common with Lewy body dementia. And also there can be some alterations in sleep and behavior. So REM sleep behavior disorder is something that's very common with Lewy body dementia, where essentially this person, their brain falls asleep, right, at night, but their body is acting out their dreams. So you may notice this person really thrashing around a lot at night, falling out of bed, really having this kind of disturbed sleep pattern. So each person, again, with any form of dementia can be very different. These are some of the common symptoms in Lewy body dementia. One of the important things to know about Lewy body dementia is that there are some medications that can have a paradoxical reaction for the person living with Lewy body dementia. So it's really important if you do care for a person with Lewy body that you are learning more about this specific type of dementia, and especially medications and how to how to respond to hallucinations or to help manage some of these particular symptoms that come along with this disease. There's another form of dementia called frontotemporal degeneration, or FTD. And this is actually a group of brain disorders that's caused by degeneration of the frontal or temporal lobes of the brain. So frontal lobe of the brain, we think a lot about behavior. So behavioral variant FTD is the most common kind of behavioral change FTD. So with behavioral variant FTD, you may see that person kind of losing their filter, saying things that they would not normally say, that may at times appear off color or impulsive. You may notice impulsive behavior. You may notice changes in that person's ability to show empathy, to really kind of connect with how someone else thinks or feels about something that they might do or say. If this disease is affecting more of the temporal lobe of the brain, primary progressive aphasia is more common, and this is a language change. And even within PPA, there are 3 different subtypes. When we think about language, this might include kind of the receptive type of language, understanding what other people say and making sense of it. And this is not a hearing change, this is a processing change. It may include an expressive change, that person having difficulty utilizing language, expressing themselves verbally, or it may be a combination of the two. And with FTD, there are less common, but there can be movement types of FTD as well. There's a type that is connected to ALS. There's a type called corticobasal syndrome and progressive supranuclear palsy. So these are even less common than the behavioral variant FTD or primary progressive aphasia. With FTD, the onset tends to be a bit younger than with Alzheimer's disease. So with Alzheimer's, we generally think about people 65 and over, and again, the older they get, the more at risk they become. With FTD, it's more common to have onset in someone's 50s or 60s. A diagnosis after the age of 80 is not very common in FTD. It can be much younger. It can be diagnosed even for someone maybe in their 30s and 40s. So just kind of the situation that this person may be in their life is a bit different, where maybe with Alzheimer's, we tend to think about, it's most common people over 65, maybe who are retired, who don't have children that they're caring for in their home typically. With FTD, that onset tends to be, 50s and 60s. It's that active working adult who may have children in college or in high school, or just in a bit of a different situation in life. And there are other types of dementia as well. Some of them include normal pressure hydrocephalus, which for some individuals can be treated. Wernicke-Korsakoff syndrome, which is typically related to a vitamin B1 deficiency, most often associated with alcohol misuse over a long period of time. Creutzfeldt-Jakob disease, which is a very fast-moving form of dementia. Huntington's disease, which has a very strong genetic component. HIV-associated dementia, particularly for those who have not been consistently on an antiretroviral therapy protocol. CTE, so we hear about this a lot with athletes like football players, boxers, but increasingly we're also hearing about those who've been serving in the military and who may experience CTE. And there are many other types as well. And for some individuals, they're not only experiencing one form of dementia, their brain may be experiencing more than one type of dementia at the same time. So most often this combination would be Alzheimer's disease and vascular dementia, but it could be other combinations as well, or it could be more than 2 pathologies. Recent research suggests that a large proportion of people who are over the age of 80 may have mixed dementia. So what does the progression look like? Every disease is different and every single person is different. You could take 2 women, both diagnosed with Alzheimer's at the age of 70 in the early stage of the disease, and they may have very different experiences. So what I'm going to share here is a typical, kind of an average path of progression, And I'm going to be focusing here on Alzheimer's disease. With other types of dementia, especially the early symptoms may look quite a bit different than with Alzheimer's disease. But since the most common type of dementia is Alzheimer's, that's what we're going to use to talk about here. So typical path of progression. In the early stage of the disease, that short-term memory loss is typically more pronounced. Memory loss of recent events, right? Not remembering that my family member or my friend called to say they were coming to pick me up in an hour, and they show up at my door in an hour, and I say, "What are you doing here? Where are we going?" Right? Just forgetting those recent things. For the early stage, that person may start getting lost, certainly in unfamiliar places, but possibly even in familiar locations. You know, maybe it's my loved one who leaves for the grocery store. I might expect them to be back in about an hour, and it's 4 hours later when they come home, right? They were able to find their way home, but there's something really unusual going on here. In that early stage, that person might misplace objects, you know, really having difficulty keeping track of their belongings, putting them in unusual places, not remembering where they put them. If this is someone within your home, you may notice, you know, when my spouse tries to unload the dishwasher, the dishes end up in really unusual locations, right? In the pantry with the food or in the linen closet upstairs, you know, really things, it's hard to keep track of where things belong. And in the early stage, that person is starting to experience some difficulty with complex tasks or situations. So complex tasks, this might be things like setting up appointments and keeping the calendar and, you know, and kind of following a plan like that. Being able to cook, you know, a new recipe, but even a recipe that's very familiar to me, all of those steps that are involved may start to become challenging. You know, making complex decisions is really hard. Being in a complex social situation like a dinner party where there's multiple conversations, I'm, you know, just my brain has to work really quickly to keep up with everything that's going on around me. That may feel really overwhelming. You know, I might not perform in that environment in the way that I would have before. You know, so these are some of the things that might be typical in the early stage, particularly with Alzheimer's disease. Now into the middle stage. And I should point out here, I'm really talking kind of a continuum. It's not like I'm just going to wake up one night in the next state, you know, or the next morning in the next stage of the disease. These are just really gradual changes that occur over a long period of time. So into the middle stage of the disease, there would be a bit more pronounced confusion. It would be more frequent for the person living with the diagnosis. They may be less able to cover up for it, you know, to kind of mask this confusion when it occurs. I may be much more as a caregiver in tune with confusion that I'm noticing in my friend or my family member. In the middle stage of the disease, poor judgment is much more of a factor. You know, where in the early stage, it's starting to become questionable. In the middle stage, really, judgment is starting to become more significantly impacted. Communication changes are much more noticeable. That word finding difficulty, maybe it's that person who is responding in a conversation, but is less likely to initiate a conversation, to ask a question, to have this kind of back and forth where we speak in more, you know, complex thought processes. In the middle stage of the disease, you might notice that person needing more assistance with activities of daily living. So these are things like getting dressed, you know, grooming, like shaving, brushing teeth, showering. Those sorts of things may start to change. You may notice your loved one who is starting to have difficulty comprehending and kind of following through with a task like brushing teeth, knowing what order to do things, where to find my toothbrush, how to apply the toothpaste, you know, how to complete that process effectively. You may notice that person who's forgetting to shower or doesn't keep up their appearance in the way that they used to, or wearing that same outfit day after day after day, if not prompted and maybe even assisted to change. And in the late stage of the disease, there are significant changes that occur with memory, you know, so just sort of think about the order that we learn things in life and the way that we kind of form memories. we are losing those in reverse order. So in the early stage of the disease, it's those things that happened most recently that I'm losing. In the middle stage, I may be losing more of that middle part of my life. And by the late stage of the disease, the only memories that may be available to me might be those from childhood or teenage years, or maybe young adult years. Our ability to communicate changes significantly by the late stage of the disease. My ability to hold a conversation. I may just have a few words or sounds available to me to communicate. I may be communicating more through my behavior than through the things that I say. And in the late stage of the disease, that person really has a significant loss in their ability to perform their kind of physical functions on their own. That person would need assistance with all activities of daily living, like getting dressed, eating, walking, showering, all of those sorts of things. And really, there is a need for full-time care by the late stage of the disease. So again, each person is going to be very different. You may be thinking of a friend or a family member and think, oh, they don't quite fit into any neat box. And that's okay. This is just kind of a typical path of progression for Alzheimer's disease. So how do we get to a diagnosis? Well, first I want to point out that if you're noticing something that is not normal for the person that's on your mind, please report it to the appropriate person or follow up with that primary healthcare provider. So if I'm concerned about my family member or my friend, I want to make sure that if I should be sharing this with someone else, that I'm doing that, or if I am that primary partner, that we are going to see the doctor, that we're going to go start with the primary care doctor just to start kind of looking at what's going on. So we're going to talk more about that in a second. Dementia is not diagnosed with any one tool. It's diagnosed through a complete medical assessment. And that may also include seeing a specialist, like a neurologist, a neuropsychologist, or a geriatrician. So these diagnostic tools, what are the steps? Again, there's no one test. There's no one cognitive test. There's no one blood test or brain scan that's going to give you all the information that you need. So starting with that primary care provider, they're the person then who's going to have that complete medical history. What medical conditions have I had in the past? Familial conditions, what medications do I take? What does my lifestyle look like? My stress level, my workload, how well do I sleep? These sorts of things are going to come out in this medical history conversation. There will be a physical examination, right? We're going to do things like take blood pressure, check out any possible pain, any physical features that may be occurring, anything that maybe we could contribute these symptoms to. There would be a neurological examination. So with the primary care provider, maybe a basic neurological examination, for example, looking at reflexes. And seeing a neurologist, of course, there'd be a much more extensive neurological examination. There may be brain imaging to do things like rule out stroke, to rule out things like a brain tumor, and to identify if there are changes occurring in the brain that are consistent with particular forms of dementia, like Alzheimer's or frontal temporal or Lewy body. There may be some lab work, like a urinalysis, to rule out a urinary tract infection, which can cause some really sudden onset of these dementia-like symptoms. There may be blood work to look at vitamin levels in the blood, to look at other sort of things to indicate if there's something else going on that's causing these symptoms that I'm experiencing. There may be an EEG, and for many people, there may be a neuropsychological evaluation. So this is that more in-depth cognitive assessment to really look at different areas of cognitive function and to see how this person is performing, and is it normal for their age and education level, or is something looking to be a noticeable change, and what should we be doing about that? So that primary care doctor, or very often that neurologist, is taking all these pieces of the puzzle and putting them together to come up with their best guess, right? It's probable Lewy body dementia, or it's probable FTD or Alzheimer's, really trying their best to come up with an answer to determine what is causing these symptoms, what underlying condition is occurring for this person. And that whole diagnostic process can take some time. That's not something that occurs generally in one visit or even two. It might take a year to 2 years to come to a diagnosis. So treatment, what options do we have for treatment? So I said earlier, Alzheimer's disease, for example, there's no way to stop or slow that disease, but there are some treatments that are available to help with symptoms. So these are pharmaceutical treatments that help with symptoms. For example, with Alzheimer's disease, some of the FDA-approved medications to help with symptoms include the brand names Aricept, Razidine, Exelon, Namenda, Nemzaric. There are kind of a handful of medications that are effective for some of the people who take them. Not everyone, and not for years upon years, but they can be helpful for some people for a while. For other types of dementia, we really don't have FDA-approved treatments for symptoms. However, there may be other kind of issues that are occurring alongside the dementia. For example, depression or anxiety or sleep changes, and there may be pharmaceutical treatments to help with some of those conditions. The course of treatment could really vary depending on the type of dementia and the stage of the dementia. Even within those medications for Alzheimer's disease, some of them are indicated for early to moderate Alzheimer's, others are for moderate to late disease. As far as quality of life, day-to-day function, even more than any pharmaceutical treatment, you're going to find that physical and social activity are so important for that person living with dementia. To feel confident, to move about in the world, physically to be as independent as possible, to socially and emotionally be connected, to stimulate my brain, to use different cognitive functions to the extent that I can to keep my brain as healthy as possible. Physical and social activity are one of the best kinds of treatment for that person living with dementia. And also treatment would include guidance and support for care partners, really to give caregivers the tools that they need, the information, the guidance, the emotional support to really provide the best care possible for their loved one. And there's so much happening in the world of research. The video from NIH talked just a bit about research. There are great strides being made in identifying potential new ways to help diagnose dementia, to treat it if it's occurring, and even to prevent Alzheimer's and other forms of dementia. Now, one of the things they pointed out in the video is, for example, with Alzheimer's, there are changes happening in the brain for 10 to 20 years before symptoms ever occur. So research is often looking at how do we intervene so many years before those symptoms ever become pronounced, right? How do we stop or slow the disease process at that point before these symptoms really ramp up to a place that they become very challenging for that person and for caregivers? There's also a lot happening in the world of research about that diagnostic side. How do we look for different diagnostic tools, for example, a blood test or a smell test that can help us, kind of put up our radar that something may be occurring for this person and we should pursue additional testing. So research requires people. It's really important for as many people as possible to get involved in research, both those who are particularly in the early stage of dementia, who are experiencing mild cognitive impairment, but also for healthy adults. To learn more about clinical trials, what's happening in our Northern Virginia area, as well as around the country, you can go to clinicaltrials.gov. And there are some really great resources in our community. Insight Memory Care Center is one place you can go for care for that individual living with dementia, for education for care partners, and support for both. Insight is located in Fairfax, but also offers a number of virtual resources for you. We record all of our webinars. You can access those online, lots of tip sheets, and lots of opportunities to talk with people who can really help guide you on this journey. You can learn more about Insight at insightmcc.org. Also, look to your local area agency on aging. So if you're here in Fairfax, the phone number and the website is on your screen for the Fairfax County Area Agency on Aging. But if you're watching this webinar and your loved one lives elsewhere, you can find that local area agency on aging as well. If you just do a quick internet search with their location and area agency on aging, you will find theirs. There are large nonprofit organizations also for each form of dementia. So most people are familiar with the Alzheimer's Association. Alzheimer's Association has a 24/7 helpline. So that 1-800 number that you can call anytime if you have a question or you have a concern, you can talk to someone. There's also a Lewy Body Dementia Association. There's the Association for Frontotemporal Degeneration, and even for the less common types of dementia, each has its own organization as well. So these are great places to find information about that specific disease and to learn more about what's happening in the world of research. And also, if you're in Virginia, you can learn more about resources in our state at the Virginia Department for Aging and Rehabilitative Services. And now I'd like to open it up if there are any questions. So as a reminder, you can click on that questions box in your control panel and type in any questions that might be coming to mind for you. Robin, do we have any questions that have come in so far?
We do. We have one question that has come in. What is your opinion on the line of study that you can help prevent Alzheimer's through diet, exercise, and brain exercises along with better sleep and stress control?
That's a great question. And that NIH video touched on some of these things, right? Healthy diet and kind of lifestyle interventions. And that's exactly what I'm going to be talking about next week in the webinar, 5 ways to take care of your brain, because there is so much that we can do to help control our risk. Now, we could do everything perfectly, right? I could have the healthiest diet, I could get the most exercise, I could get great sleep, I could do all these things. And it's still possible that I could develop dementia because risk factors are not only around these lifestyle interventions. But a few years ago, I remember hearing some research that said about 1/3 of all dementias are preventable. And really what that study meant was about 1/3 of all dementias were related to these lifestyle interventions and not just kind of waiting until, maybe I'm at the age of 60 or 70 to start thinking about my brain health and how I can take care of my brain as I age, but really thinking throughout that entire lifespan, about all of these things that are good for my brain. So that's what I'm going to get into next Tuesday in the webinar are these specific ways that we can do everything we can to take care of our brain. So I hope that you'll join us, and we will record that webinar. So if you can't actually attend on Tuesday, please register anyway, and then you'll get a link to the recording afterwards. Any other questions that have come in?
No other questions at this time.
Okay, great. So I mentioned that there is a webinar next Tuesday. That is September 22nd, again at 11 a.m. until noon, and it's called 5 Ways to Take Care of Your Brain. So if you'd like to register for that class or learn other information about Dementia Friendly Fairfax, there's a link there on your screen where you can learn more about what's happening with this initiative and how you might become involved. And you will receive an evaluation after today's class if you're listening live. So it will pop up right after the class, but if you don't have a chance to complete it then, you'll also get a link to the evaluation in the follow-up email that will come in a few hours with the link to the recording and also the link to the evaluation. And now I'll turn it back to Robin. Any last words for you, Robin?
No, thank you, Lindsay. That was a great, I learned a lot. I think, I've been with Insight for 7 years and I still learn, so it's great. So thank you so much. I hope everyone enjoyed and got additional information. And as Lindsay has already said, there's another webinar series next Tuesday on the 22nd at 11 a.m., 5 Ways to Take Care of Your Brain. So hopefully you can join us for that. And we really thank you for all of your time today. And feel free to reach out to us if you have any additional questions, and hope you have a great rest of your day. Thank you.